Welcome to this video on enlarged tonsils and adenoids. These conditions can greatly affect a person's well-being, and it's important for healthcare professionals to understand their evaluation and treatment. We will cover their causes, diagnosis, management, complications, special considerations, and advancements in surgical techniques. Let's begin. Enlarged tonsils and adenoids, known as adenotonsillar hypertrophy, are common in children. They cause various symptoms such as difficulty breathing, snoring, and recurrent infections. A thorough examination and diagnostic tests are necessary to assess the condition. Let's now delve into the anatomy and physiology of tonsils and adenoids. The tonsils and adenoids are lymphoid tissues located in the oral cavity and nasopharynx, respectively. They function as the body's first defense against pathogens. Understanding their anatomy is crucial when dealing with enlarged tonsils and adenoids. The enlargement of tonsils and adenoids can have a multifactorial etiology, including chronic infections, genetic predisposition, environmental factors, and immune system abnormalities. Chronic inflammation due to recurrent infections can lead to hypertrophy of the lymphoid tissue. Additionally, allergies, gastroesophageal reflux disease, GERD, and obstructive sleep apnea have been implicated in the pathophysiology of adenotonsillar hypertrophy. Understanding the underlying etiology and pathophysiological mechanisms is crucial in guiding appropriate diagnostic evaluation and management strategies. Speaking of diagnostic evaluation, let us proceed to our next topic. The diagnosis of enlarged tonsils and adenoids involves a thorough assessment of medical history, physical examination, and diagnostic tests. These tests may include imaging, polysomnography, allergy testing, and cultures. Accurate evaluation is important for proper diagnosis and management. Unmanaged or undertreated enlarged tonsils and adenoids can give rise to a range of complications and consequences. These may include recurrent ear infections, persistent nasal congestion, obstructive sleep apnea, dental malocclusion, speech and language delays, behavioral changes, growth disturbances, and even cardiovascular implications. Understanding and addressing these potential complications is essential for optimizing patient outcomes and preventing long-term sequelae. Now, let us explore the various medical management options available for the treatment of enlarged tonsils and adenoids. The medical management of enlarged tonsils and adenoids revolves around alleviating symptoms, treating underlying infections, reducing inflammation, and preventing complications. Depending on the severity and etiology of the condition, various conservative strategies can be employed, such as anti-inflammatory medications, nasal steroids, antibiotics, decongestants, saline nasal rinses, and allergy management. These approaches aim to improve symptoms, reduce the size of the tonsils and adenoids, and minimize the need for surgical intervention. However, in cases where medical management fails or complications arise, surgical treatment becomes a viable option. Let us now proceed to discuss surgical treatment modalities, including tonsillectomy and adenoidectomy. In the video, we will discuss tonsillectomy and adenoidectomy as surgical treatments for enlarged tonsils and adenoids. Different techniques are used based on factors like patient age and desired outcomes. We will also cover anesthetic considerations in these procedures. Tonsillectomy and adenoidectomy are commonly performed under general anesthesia, and several anesthetic considerations should be taken into account to ensure patient safety and optimize surgical outcomes. Preoperative assessment, airway management, fluid and electrolyte balance, pain management, and postoperative nausea and vomiting prophylaxis are among the topics that need to be addressed by the anesthesiologist. Understanding the nuances of anesthetic management is crucial for minimizing intraoperative and postoperative complications and ensuring a smooth perioperative course for the patient. Now, let us turn our attention to special populations that may require modified approaches in tonsillectomy and adenoidectomy. Certain patient populations, such as young children, adults, patients with comorbidities, and those with specific syndromes or anatomical variants, may require special considerations when undergoing tonsillectomy and adenoidectomy. Age-appropriate techniques, modifications in anesthetic management, and careful patient selection are essential to minimize the risk of complications and optimize outcomes. Understanding the nuances of managing these special populations is crucial for providing tailored and individualized care. Now, let us proceed to discuss the postoperative care and potential complications associated with tonsillectomy and adenoidectomy. Postoperative care plays a significant role in ensuring optimal recovery and preventing complications in patients who have undergone tonsillectomy and adenoidectomy. Pain management, fluid and nutrition optimization, activity restrictions, wound care, and postoperative follow-up are crucial components of postoperative care. Additionally, it is important to recognize and manage potential complications such as bleeding, infection, dehydration, airway compromise, and delayed recovery. Monitoring patients closely during the postoperative period and providing appropriate interventions are key to ensuring favorable outcomes. Now, let us explore the long-term outcomes after tonsillectomy and adenoidectomy. Understanding the long-term effects of tonsillectomy and adenoidectomy, including quality of life, sleep issues, speech development, and cognitive function, is essential. Studies show these procedures can improve symptoms, but outcomes may vary. Regular evaluation and surgical advancements are important for long-term management. Advancements in surgical techniques and technology for enlarged tonsils and adenoids include minimally invasive approaches like coblation and powered instrumentation, surgical robots, and image-guided navigation systems, improving outcomes and patient care. Understanding these advancements is crucial for evidence-based clinical decision-making. Enlarged tonsils and adenoids are common conditions that significantly affect patients' well-being. Understanding their presentation, anatomy, causes, treatment, and advancements is crucial for future healthcare professionals to deliver the best care. Let's keep learning and adapting in this field.